Hi, welcome to PegLuksik.online. I'm PegLuksik, and today I want to talk about the coronavirus crisis. Not from a medical point of view, I'm not a medical doctor, but as a nation, we have decisions to make, and there should be some bases upon which those decisions are made. Now, we hear a lot about constitutional rights. That's not actually the accurate way to portray what is happening. Our rights don't come from the Constitution. They come from God. We were created with those rights. And the language in the Constitution was designed to protect the rights that God gave us. Our right to practice our faith, our right to freely express our opinions, our right to gather, our right to bear arms, our right to be safe and secure in our properties, and to actually have ownership of our properties. Those all came from God. And if you look at the Constitution, particularly in the Bill of Rights, doesn't say, yes, the citizens may. It says, no, the government may not. The government may not take actions that would infringe on rights that we were created with. The Constitution doesn't give us those rights. It doesn't confer them upon us. The Constitution protects the rights we already have. So the accurate way to put it is God-given, constitutionally protected rights. Well, how does that fit in how our society works? We all know that there are times of emergency when things need to happen quickly and when normal processes don't apply because they would actually be harmful. So we, the people, the owners of those rights, voluntarily cede authority for exercising them to the government in times of emergency. Now, emergency needs to be clearly defined. And sometimes that doesn't even require discussion. A hurricane, a tornado, a flood. We all know those are emergencies. You kind of can't miss it. So we voluntarily cede the authority, we cede our ability to exercise our God-given, constitutionally protected rights so that the emergency can be dealt with. And in the early days of this pandemic, everybody kind of agreed with that. As we move forward, the question is it still an emergency? How big of an emergency is it? And how much authority are we willing to voluntarily cede to the government over the exercising of our God-given, constitutionally protected rights? Well, to answer those questions, we need information. And the first thing we need is accurate data. It's very hard to make a decision when we don't actually know what the numbers are. We see death tolls go up and then come down from the same government entity. Nobody actually recovers from being dead. So the death numbers should never go down, but they have, and sometimes dramatically. We are told that the death counts aren't actually people who died of the virus. I listened to one press conference where one state secretary of health said, this many people died who were tested positive of the virus. Okay, but did they die from the virus? Or did they die from heart disease or diabetes or a stroke? And in the autopsy, you found out that they tested positively for the virus. They may not even have had any symptoms. We don't know that information, and yet we should have it. How many people have actually tested positive? In one state, we have found out that if a person took a test more than once, they didn't count that as one person. They counted it as if it were however many people instead of one person with that many tests. Why would a person take more than one test? They're a healthcare worker. They're wondering if they can go back to work. They have a job where they can't come back, whatever it is. And so they have to take more than one test. That's not 5 people. That's one person being tested multiple times, but then it's listed as 5 people. Well, if you can't get accurate information, you can't make good decisions. The way the information is presented is not accurate. What we're told is state X has this many positive cases. No, it doesn't. Because this many positive cases, this big number, which is the conglomerate of all the cases that have been counted from the last 7-8 weeks. Well, in 7 or 8 weeks, something happened to that person. They either recovered or they didn't, but they're no longer still active. Wouldn't accurate information be how many people currently are testing positive in that town, county, state, whatever it is? But we don't get that information. How many hospital beds are currently in use? What is the percentage? How many beds are empty? How many beds were ever used? Was the hospital close to capacity? Is it close to capacity now? You have to dig to get that information. It should be readily available because it's part of how we make decisions on accurate data. What is the demographics of the people who have gotten it and have had bad results? Now, if you dig, you can get it, but that doesn't become readily available. It looks like instead of using numbers to inform us, some government entities are using numbers to frighten us. And that's unconscionable. Because you should not frighten American citizens into ceding their ability to exercise their God-given, constitutionally protected rights based on fear when that fear is not warranted. So if we're not getting accurate information, there's a problem. Second, in government assuming authority in an emergency, they should use the least restrictive means, and anything they do should be backed up by empirical evidence which is presented to us for review. I keep hearing we should trust the science, except we never get any. We have governors saying, well, I feel I made standards. No, I'm not actually doing that now. It's going to be subjective. I'm the governor and you're not, are statements that are made. These kinds of statements don't pass constitutional muster. So remember, we the people, we're not mandating anything to anybody. The burden of proof does not rest with us. It rests with the government entity, local, state, or federal, who is asking our permission to stop exercising our God-given, constitutionally protected rights and allow that government entity to have more control over our daily lives than they normally would have. So, for example, where is the empirical evidence that says a big box store can safely sell product X in town Y to population Z, but a small business selling the same product to the same population in the same town cannot do so safely? If we're talking about social distancing, you would think you wouldn't want all the people congregated in one store. You'd think you'd want them divided out among as many places as possible so it would actually allow for more social distancing. But I haven't seen any empirical evidence that says you're safe in a big box store from catching this, but you're not safe in the small business across the street. Where is the empirical evidence that says a grocery store, for example, can safely operate with X percentage of its fire code occupancy, but a church in the same town with the same people can't safely be open with the same percentage occupancy? Where is the empirical evidence that says I am safe in a parking lot in a drive-by restaurant, but I'm not safe attending church in a parking lot in my same car in the same town? I haven't seen any empirical evidence for that. Where is the empirical evidence that says I'm not safe on a beach or in a park, but I am safe on a golf course or a marina? I thought sunshine killed the virus. That empirical evidence has in fact been presented to us. So why are we being told you're not allowed to go into the sunshine? Or you can only go into the sunshine here, but not there. For the people making those mandates, where is the empirical evidence proving that that mandate, that infringement on our right to assemble is warranted? Now, maybe it exists, but I haven't seen it yet, and I bet you haven't either. Where is the empirical evidence proving that mandating that everyone wear a mask every time they leave the building is in fact in your best interest? Slogans are not evidence. This mask protects you and you from me. That's not evidence. Why did the Surgeon General say no, and now, as the virus is attenuating, all of a sudden say yes? Where's the evidence for that? Why does the WHO and the CDC disagree on whether or not you should wear a mask? Where is the actual empirical evidence on forcing people to wear a mask, to shop, to walk in a park, to do any of the activities that we would consider every day? Where is the empirical evidence for that? If there is no empirical evidence, then there is no grounds for asking us to cede to a government authority our God-given, constitutionally protected rights. Now, there is empirical evidence that says suicide rates are up, drug addiction is up, domestic violence is up, some kinds of crime are up, people are living, poverty rates are up, unemployment rates are up, children are hungry. All of that is demonstrable. We know there is empirical evidence now. The CDC is saying a lot more people than we anticipated are dying of things like heart disease, diabetes-related conditions, strokes, appendixes that are having more peritonitis cases than they did before. Where is the empirical evidence that says keeping hospitals empty is keeping people safer? The empirical evidence would appear to point the other way. So where is the empirical evidence justifying denying health care to people who don't have COVID? Elective surgeries don't mean they're not important. They mean they're not emergencies. Where is the empirical evidence that says denying that non-COVID health care is actually better for us than not? I haven't seen any empirical evidence that way. Again, maybe there is some, but it is incumbent upon the government entity to produce it. They are the mandators. Therefore, the burden of proof rests with them. And we kind of looked at this underlying piece. Tomorrow, we're going to look at what do we do about it? How do we move from A to B? How do we ensure that we get the evidence we need so that we can make decisions about which and to what degree we want to cede our God-given, constitutionally protected rights to a government entity? How much of an emergency is this, and what is the appropriate response? The answer to that question does not lie with secretaries of health. It does not lie with elected officials. It lies with us. Our constitutionally protected rights, they live with us. The government must ask. They must prove their case. And if they don't, they must back off. I'm Peg Luksik, and this is PegLuksik.online.